Today we're talking about inflammation and pain. I have a client here who has kindly allowed me to record this so that it will be a benefit for all of us as we move forward. So one of the things that I'd like to talk to you about is what you mentioned to me, is the pain. And the overall pain aspects that you're experiencing in terms of the joint pain, the inflammation issues that are occurring because of that the doctors have told you about. The underlying aspect of that, along with the surgeries that have been done for hip replacements, as well as the pain that you're experiencing in your muscles and so on, is that really it's all to do with inflammation. Right. So the more that we can address the inflammation, the more we're going to help to take care of all of the aspects of what you're experiencing. Does that make sense?
Totally.
Okay. So really what we want to look at is a couple of things. How do we reduce the fires that are going on in the house? Right? And one of the things that we want to do that we've talked about before and that you're doing well in is the diet piece. And what that means is triggers. What is triggering the fire in the house? What's triggering the inflammation that then causes all these chemicals to be released that then starts to break down the house, right? So when it comes to your bone, it's really the bone aspects of what we've talked about in terms of the neck things that you're having issues with, the different parts of the neck bones, the hip bones that have been replaced, the knees that are basically bone on bone. Is that we want to make sure that we're helping to sustain those bones. The reason a lot of time bone, in essence what's happening is they're dissolving, they're breaking apart. And so we would call that either osteopenia, which is with the beginning of it, or osteoporosis if it is more advanced. And then you can end up having things like osteophytes and so on. And all that really means is that you are creating spurs, that wherever the bones are leaking and dissolving, it basically, if this is the bone, it's dissolving out, and as it dissolves out, it's creating those spurs. And those spurs then can affect the tissue around it, which could either be the nerves or the muscles or other aspects of your body that then basically creates a signal for pain. So if in the neck area, if the bones are dissolving, then basically they're not able to hold you up. They're not able to hold you posture-wise, but also the weight becomes an issue. So it starts to push against each other. As it pushes against each other, that then is going to cause the pain because the nerves are being squished, right? Does that make sense?
Totally.
All right. So what we need to do here is, yes, at the point where you're at, if you're needing pain relief and pain support, there might be a place for prescription medication to help you to manage that. But at the same time, we want to kind of build the bones back up, change the environment inside your body. Right? What's going on that's making the bones dissolve? What's going on that's making the bones weak? Right? So there's some basic things that we can work on there, and that is basically that if the internal environment of your body has all the building blocks that it needs and is in the right temperature, right? So think about it like a house. A house is comfortable when it has everything in it, when the temperature is right, when the humidity is right. So the internal environment of the house, the internal environment of your body is what we really want to kind of pay attention to. I found over my 40 plus years here of kind of working of doing this, and 30 years of really getting into this approach of helping people, which is combining medications or the medical approach as well as combining the natural approach and really looking at the underlying issues, is that we need to look at the environment that we're creating in our body. Okay, so what happens with inflammation is that the internal environment is out of balance. So if you think of it like a house, the temperature is either too hot or too cold, or the humidity is too high or too low, or the support mechanisms of how that house works inside are starting to break down. And so the key is you want to look at is something called acid base, right? So the more acidic your body is, right? So think of it like, for example, soft drinks, right? Sodas. we know that, and I'm sure you've seen this on YouTube or on the internet or even on TV, where they show you a glass of soda and then they put something in it and it starts to dissolve away. That's because the soda is very acidic. And a lot of times that's exactly what's happening to our body and to the bones, is that they're actually getting leached. So the minerals are getting pulled out and you're literally dissolving those bones over time. Now that can happen from many different reasons. It could be from stress, it could be from the things that you're eating, it could be from the things that are basically coming into your body that are changing the environment inside your body. So we need to look at the triggers, right? What are the things that are making your body acidic? So that's one aspect of it that we need to look at. Another aspect of it that we need to also look to see is that what are we doing to help to get the nutrients into you, right? A lot of times we'll take supplements or we'll take food. I've had people tell me, Vimal, all I want to do is just eat the right kind of foods and that'll get me to where I need to be. Well, to an extent that's true, but if the fire is the demand of the fire is higher in burning things in the body, in terms of the house, and you're putting a little bit of water to douse that fire, is that going to be enough? No. So that's where the need for proper amounts of nutrients that are clinical grade come into play. So this is why we take supplementation, right? So it's important to supplement as well in terms of the right things, so that we need to kind of look at to see what are the pieces that are being broken down. So when it comes to your bones and the pain that occurs because of that, in terms of the dissolving of the bones, is we need to break down the bone aspects as well. So what kind of things are the bone made up of? Well, they're made up of collagen, they're made up of minerals and electrolytes, they're made up of protein. So getting those things back into you. Well, how do we get that into you and how do we get it transported? So that's another thing that we also need to look at is, do we have all the right components? Just because you're taking supplements or you're eating something, is it really being broken down, digested and absorbed and taken to where it needs to? All right? So we need to look to see if there's things going on in the digestive system as well. But with the things that we've talked with you, and I know you've made progress, you've lost weight, you're following the food aspects that we talked about. So what I really want to talk to you about is to make sure that that we're putting things back in to really help to maintain that environment that is alkaline, not acidic, that the nutrients that you're taking are actually being broken down, being digested, and that you're getting it out of your digestive system into your body, so that it helps to reduce, helps the bones to kind of build themselves back up as well, right? The other thing that we also need to look at is making sure that we're not only putting things back in that help the bones, but also putting things back in that help you to manage and contain your own pain management system. Right? Our body has an ability to handle pain. It's not just a signal of pain, but it actually has an ability to reduce pain as well. Because we make things in our body that actually medications and non-prescription items go into and fit into the same receptors that help us to manage pain as well. So you actually make internally, there are things called endorphins and enkephalins and things like that basically help you with pain management as well. A good example is when you're singing, when you're happy, that reduces pain. The reason it reduces pain is because you're releasing these internal chemicals that your body makes to help to manage pain reduction as well. So inflammation also can be helped with healthy fats, right? So making sure that we're consuming the right kind of healthy fats also helps us to manage the signaling to help to reduce inflammation as well. Does that make sense?
Totally.
Okay.
The difference between avocado and butter and margarine.
Correct. That is the difference between having good, healthy fatty foods like avocados, like grass-fed organic butter, ghee, coconut oil is also useful. Fish oils, right? This is one of the reasons why we know that fish oils are very beneficial for the whole body. It actually helps to reduce inflammation.
Really?
Yes. Huh. So taking healthy fats helps us to reduce inflammation. So it helps us to calm down the fires that then basically create an acidic environment that then causes the bones to get leached.
So do you take the fish oil in the morning or in the evening?
You want to take healthy fats evenly throughout the day. Yes. Now, the other thing that's also important is that the more you manage your weight, right? Weight management, that means that not only does it mean that you're reducing the amount of fat in the body, but fat cells that have more extra storage of fat is not just storing fats, they're actually storing toxins. And the toxins are going to behave like inflammation triggers. And the toxins can also, not only that, but then when the fat cells have more fat in them and they have toxins stored in them, they actually start to produce chemicals that causes more inflammation, that causes damage throughout the body, not only in terms of the acid alkaline environment, but actually affects all types of organs in your body. So it goes beyond the bones. It actually affects all aspects of your body: the circulation, the heart, the liver, the kidneys, the digestive system, your muscles. Everything is affected when those fat cells are releasing chemicals that are sending signals of inflammation throughout your system. So it's basically starting a fire and sending signals of fire everywhere as well. So controlling your weight and controlling, more important, not so much weight, but controlling the amount of fat percentage that the body has is very important as well. So helping to have a good dietary management approach is something that we need to look at. Now, all of these pieces are pieces that we need to take time on to see what is specific to you, and how do we make it so that it's customized to you. So I want to kind of give you this overall picture, right? That look, the pain issues that you're experiencing are beyond just the pain that is occurring because the nerves are being pinched, or that the muscles are out of balance in terms of the balance of chemicals that the muscles need, and so they're sending a signal of fatigue and tired and pain as well. But all of these signals creates the body to become more acidic. So acidity is number one. So we need to reduce acidity in your body, and not acidity as in like the stomach acid thing. No, that's not what I'm talking about. I'm talking about the overall body and how it prefers to be alkaline, how it works, how all the chemistry works better, how everything flows better when things are alkaline in your system, and how you don't actually create fires. You actually calm things down when things are. So the internal chemistry or the internal environment needs to be more leaning towards alkalinity. So this is where alkaline diets come into play, alkaline foods, alkalinity in terms of alkaline water. All of those types of things are going to be important. From a dietary standpoint, you also want to avoid things that make your body acidic, that basically starts fires. Generally speaking, that tends to be things that are processed, so processed foods, sodas, coffee, drinks, things of that nature, and then also carbohydrates. And carbohydrates in the form of breads, potatoes, pasta, rice, noodles, things that break into sugar quickly. And quite frankly, that is the key word here, is to reduce sugar. Because we know that sugar basically, once it's used in your body, makes the body more acidic. And it actually starts a whole bunch of fires outside of that. For example, we know that sugar, when you consume sugar, added sugar, it actually reduces your immune system. If you were to check your blood levels for your immune levels, after about 30 minutes of consuming sugar, it actually reduces your immune system. Now, the immune system is actually there to help you to repair and heal as well. It doesn't just fight infections, it actually helps with repairing and healing. So if you have issues with inflammation and pain, we also need to address the immune system too. So you see how all of this is tied together. And where is the immune system? Most of it is in your digestive system, right? Because that's where things come into your body. So the soldiers are lined up where at the border, and so most of your immune system's in your GI. So you can see how all of these things are connected together. So it's not just about addressing the pain. We're going to address it. The way we address it is by uncovering the underlying issues and looking at all these different aspects. So let's recap. What are we talking about? Reducing acidity in the body, okay? Making sure that we're eating the right kind of foods that helps us to create more alkalinity increase the healthy fats that are coming in, so that we actually are sending signals to reduce inflammation by having the healthy fats. They also help with repair and healing and rebalancing things out. And then from a dietary standpoint, also making sure that we're getting rid of the toxins that are in the fat stores that we tend to have if we're overweight, or if we're not eating the right kind of healthy fats. Does that make sense?
Totally.
Okay, so that's the kind of overall aspect that we want to look at to help you with your pain management, is identify the buckets in your body that are being depleted because of the pain. Identify the buckets in your body that are being depleted because of the acidity in your body, right? Because it's the inflammation. The minute you have inflammation, you're throwing all your chemistry off. The minute you're throwing all your chemistry off, you're basically dumping things and depleting things out of your body a lot faster, out of balance. So identifying those things that are out of balance helps us then to create a unique program that's for you, because certain buckets are going to be emptied faster than others because of your makeup compared to someone else. Okay? All right, so that basically is what we're talking about when it comes to the general picture. So I hope this was good experience for you to understand how to kind of look at your overall pain management aspects, as well as how to look beyond just taking pain medications or supplements. Because, a lot of times, and I'll be honest with you, even though I'm a pharmacist, I look at it as a place for using the appropriate medications and or supplements. But the mentality that we have is really something that I want to encourage you to understand, is that you want to make sure that you're looking for the balance aspects and the overall picture, rather than just looking for solutions that takes care of the symptoms. So you can have a prescription solution, you can also have a supplement solution, but you're not really dealing with the underlying issues if that's all you're doing. Then you're just chasing symptoms. You're just using either medications or supplements to address the symptoms. You're not really addressing the underlying issues. So think that way to help yourself, is that what are the underlying issues and what can I be doing other than just, obviously take care of the symptoms, but what could I be doing at the same time to address the underlying issues? So we'll leave it at that, and then we'll move on to the next one.